A report from the Military Health Systems News Center.
An interview with Dr. Stephen Ferrara, Acting Assistant Secretary of Defense for Health Affairs. Dr. Ferrara was appointed as the top military medical advisor to the Secretary of Defense on January 20th, 2025. How does the military health system support the Department of Defense in achieving its goals and objectives?
I genuinely believe that, we are a force multiplier for the warfighter. We improve and increase lethality of the warfighter. And we do that through a number of ways. If you look at what our mission is, our primary mission is supporting the warfighter in combat. And I think it's very empowering, and it's a sacred pact we have with the warfighter that when they go into harm's way, should they become ill or injured, that they can have the confidence of knowing they're going to get world-class health care immediately on the battlefield and have the best opportunity to return home healthy and in good condition. And so that empowers that warfighter to be able to take the risks necessary, to be able to have that confidence to go do those really difficult missions and know that we're there backing them up. I think we've seen around the world recently, most other countries don't do that for their soldiers. And so that's a real, I think, strategic edge that America has because we do that. And it's expensive and it's complicated, but it's 100% aligned with, American values. And so I think we sort of carry those values of Americans to do that.
What priorities have you set for the military health system to ensure that we are advancing the care provided to our beneficiaries?
The number one priority is supporting the warfighter. And I think if we have to do anything well, we're a military health system that goes to war.
We're going to watch them overnight in the ICW.
Which makes us completely unique in America. Now, we of course want to provide as high quality healthcare here in Garrison as any other top performing healthcare system in America, but we're the only ones that can go to war. So I want to be keenly focused on, are we ready to go to war and can we support the warfighter? I think we all understand that the next wars will be a different battlefield landscape and medical care delivery landscape than the prior wars. When I was in Afghanistan, we had 3 Role 3 hospitals that were fixed facilities. We had the golden hour, we had air superiority. So that was, it was a difficult mission set, we became, I think, really good at it and provided really good care. I think if we pivot and we look at sort of the threats in the Indo-Pacific, it's a much more distributed, it's a much more the tyranny of distance. I was a West Coast sailor for most of my life. I've sailed from San Diego to Africa and back many times. And when you realize that AOR is 54% of the surface of the Earth, the challenges of providing that health care and not having that golden hour. And so how do we provide prolonged field care? How do we have the people with the training and the platforms and the infrastructure to be able to do that? So that's my top priority. What flows from that is what we do here in our CONUS mission in the MTFs, which is making sure that our folks, that we always have a ready medical force so that people are getting the reps and sets they need to be able to continue to be ready to go at a moment's notice and that they're at the top of their game. And then the third thing is, these are our fourth generation platforms. So, the military is a relatively young person's occupation. You can serve a full career and retire before you're 50 years old. So we always have to be mindful of that we're passing along the baton and we're making sure that we're training, that next generation. And we do those throughout many platforms, but, a lot of them are in our MTFs, whether we're training surgical technologists to be able to support battlefield surgeries, whether we're training logisticians to learn how to basically order the supplies that are needed in order to enable medical teams to do what they need to do, training medics and corpsmen, all those kind of things that we do so that we can succeed on the battlefield.
What are some key factors that make the military health system exceptional?
We're certainly the strongest and we're the most resilient. I think that's part of our culture. One of the things that's fun, I mentioned I joined in 1991. without a lot of forethought. I think like a lot of people that I certainly didn't envision that I would still be involved, almost 35 years later. But one of the things that makes this such a fulfilling and interesting and the type of career that you like to be around is because we are always innovating and it's never the same. We're not in status quo. We're tackling new and difficult missions all the time that are unique. We're looking hard at leveraging technology, mentioning innovation. When I talk about how are those folks delivering healthcare in austere environments on the next battlefield, how are we going to equip them to succeed and to take great care of patients? And I think we are looking to, what can we do with synchronous and asynchronous technologies to support them either, again, in the moment, remotely, or with tools they can have that, are technology enabled to be able to do those things. And that's not a need in the private sector. So that does, again, it makes us a very unique and a very exciting and interesting healthcare system because we have to be ready to deliver healthcare in any corner of the globe, anytime. We do a lot of research and we do a lot of work on blood products, and that was a big thing that I think contributed to the general healthcare system. One of the things that I'm proud of is the military health system over, a century and a half. A lot of the greatest innovations in medicine have come from the military health system, and so we continue that legacy. We sit on broad shoulders, but we know that, we're not done. The next challenges will bring new innovations for us.
What is the primary message you want to share with service members and military families?
I'm their voice. I look at, when I try to describe what is the role of the Assistant Secretary of Defense for Health Affairs, because I don't know that I would have known that when I was, early in my career. I was so far off. But this role kind of sits as the CEO of this large, complicated healthcare system. And so to basically be that person that's making the decisions on manpower, making the decisions on how we resource our substantial, $61 billion budget and how we utilize it most effectively. But also importantly is, which I think it's a wonderful constitutional design that we have civilian leadership of the military. So I am, represent the civilian leadership, that oversight of the military, in which makes me be that conduit to the Secretary and to the White House of what our folks need to be able to succeed and be that voice, because I know those are their priorities, is to make sure we're delivering the best health care to our, not only our active duty, but our retired and dependent beneficiaries.
What is the primary message you want to share with the military health system workforce serving around the world?
First thing would be just to extend my thanks, to thank you to folks, because I know, again, I deployed 4 times and, I served, and I'm actually a military spouse. My wife is still on active duty. She's deployed. So when I sit down at dinner, we have 59 years in uniform and 8 deployments. I know what people sacrifice. Missed a lot of birthdays, missed a lot of those things. So I know those people are doing that and I want to thank them. There's a lot of sacrifice that goes into being part of the workforce and the military health system. But people do it and they turn on a dime and they do amazing things. So most important thing I could say is I know what they do and I appreciate it. And also that I'm trying to help them get what they need. I know people, sometimes you feel like when you're out there, you're sort of isolated and alone, or you may not have a voice, and because we are a very large system. But I'm trying to help make the system feel smaller to people so that they don't feel as far removed, and so that their voice is heard and that their voice does get transmitted. And there's always competition for resources, there's always for whether it's more money or more people, and that I understand the interconnectedness of healthcare. I think of healthcare as like an ecosystem where it takes everybody to build. It's not just the surgeon wielding the scalpel. They might be the most sort of obvious person, but behind that surgeon is a huge cadre of people, again, from logisticians, from technologists, from to nurses, to environmental services people, to facilities managers that are doing all those things to make sure that we were able to sort of deliver. And I think there's a really good military analogy. We talk about, what it takes for a trigger puller to do what he or she needs to do. The people, the tail on that is immense, so that they're fed, they're clothed, they're housed, they're warm, they have the ammunition they need, their weapon works. All those things so that they can execute that mission, which is really the primary mission, relies on all those people. And healthcare is the same.